Gegroet en hartelijk welkom bij Recht met Robinson hier op Litnet. Ek is Freek Robinson. Kennis is besorgd dat 'n derde golf van die COVID-19 virussiekte die land kan tref. En dit sal nog erger wees as die vorige twee. Hulle baseer die kommer op 'n vinnige toename van infeksies die afgelope dae. In die geheel sedert verlede jaar is 1,6 miljoen infeksies aangemeld. Daar was meer as 55.800 sterftes. 'n Ligpuntjie is dat 1,5 miljoen mense herstel het. Dit is 94% van die bevolking. Maar met die inenting gaan dit maar bra beroerd. Net 652.000 het al hulle inspuitings gekry en dit is maar 1,08% van die land se mense. Ons gas is Dr. Michelle Groome, sy is die hoof van die Nasionale Instituut vir Oordraagbare Siektes se afdeling vir openbare gesondheid, waarneming en optrede. Doctor, welcome. Nice speaking to you. Tell me, first of all, are you as concerned about others about this third wave?
Yes, we are concerned. I mean, we have been picking up these, increasing trends over the last couple of weeks, and I think the provinces have responded, have been acting quite differently in this wave, where we saw the initial kind of increases in the Northern Cape, then started seeing increases in Free State, Northwest, and now most recently Gauteng. So those are the four provinces at the moment that we're most worried about. I think the Northern Cape has actually surpassed the peak of the previous wave in terms of the number of cases that they've been seen there. And definitely, according to the metrics that we use and at the Modelling Consortium have developed, Northern Cape, Free State and Northwest are all already into their third wave, and Gauteng is getting quite close. So I think we are definitely concerned about those increasing numbers.
Why do we have these differences in the various provinces?
Yeah, well, I think when you look at data at the national level, I think you see these, this nice first and, second wave being higher than the first wave, and, with the peaks in July for the first wave and December, early January for the second wave. But I think when you start looking at the provinces and even so a province like, Free State had actually a smaller second wave compared to the first wave. And so, that was one of the provinces that we started seeing increasing cases, before the others. And similarly for Gauteng, compared to say KwaZulu-Natal, we didn't have a very much bigger second wave compared to the first wave, because as you remember, it started off in kind of the coastal provinces and then moved inland. And I think by that stage, there were some added restrictions. And so we didn't actually have a hugely bigger second wave. And so it seems that Gauteng may be at an increased risk. And we're not too sure what that's caused by. I mean, it may just be that you have pockets of people that have actually not been infected in the other two waves. So maybe there's less immunity in certain, areas compared to others. So we can't say for 100% sure, but yeah, definitely there are differences at sub-district and district levels.
Are there lessons that you've learned from the previous two waves that are standing you in good stead now?
Yeah, so definitely. I mean, we've been able to improve our reporting. We're able to do more tests. There's the use of the antigen test, which provides a much quicker turnaround time, so people can be diagnosed. So the earlier you're diagnosed, the sooner people can isolate or quarantine themselves, and so decrease the transmission. So we've definitely been able to put a lot of surveillance and monitoring platforms in place. And I think we've learned just in terms of, there was that hard lockdown initially for the first wave. And I think we've learned what are the things that do work in terms of trying to decrease transmission and others that may not be as useful.
What is working?
Yeah. So I think we know that, decreasing interaction between people. So limiting social gatherings is definitely something that we would want to see maybe, those type of restrictions coming in again, because we know there's been a lot of, in the first and second waves, religious gatherings, people getting together for large social gatherings, funerals. Those were often the types of situations where there was spread. And so definitely we know that reduction in contact between people. We know that now that mask wearing does help. Hand sanitizing, and maintaining social distances. And I think these are some of the factors that we may also contribute in part to a third wave, because I think people are really tired more than a year later, of the same restrictions of having to wear masks, to not be able to gather in large numbers. And so I think we have been seeing a little bit of complacency and just they call it COVID fatigue, where people really just are tired of having to adhere to the restrictions. So that possibly could be contributing to the increased numbers. We also know as we go to winter, people are less likely to want to gather outside, which it's much better to gather outside where, you're not in such, the virus doesn't have a chance to circulate as freely. And so now with winter, people are less likely to want to have their windows open, or, in the taxis for people to travel, with the windows open. And so that's also another risk in terms of, what we may be seeing in a little bit of the increase in the case numbers now. But I think that's the best thing we have at the moment, is for people really to keep on using what we call the non-pharmaceutical interventions, which is mask wearing, hand sanitizing, and social distancing.
Do you believe, as a result of this fear that we might have a worse wave coming our way, that there should be harder restrictions now than during the second wave?
Yeah, so we do have certain kind of clear metrics that the Ministerial Advisory Committee did put in place, to try and triggers that we would be able to have a look at. And I think at this stage, I really don't think we're not going to need to go to a hard lockdown. But I think things like maybe, decreasing the curfew would stop some of those social gatherings, where people are out partying late at night, and with the use of alcohol, and that often there's less inhibition and people are less likely to comply with with social distancing, and probably to limit the social gatherings. I think this wave is very different to the second wave, which happened during the holiday period, when there were lots of movement of holiday makers, the schools were closed, the universities were closed. Now the wave's coming at a time when people are more in the normal state. The schools are back, the varsities are back. We have seen quite a lot of cluster outbreaks in the schools, school sporting events, in the universities. And so it's difficult because, we have to weigh up the pros and cons of actually, closing schools. I don't think that's an option. I think the harm to children is just too much. And so we need to really try and look at the best ways to put in these restrictions with the least harm, to the vulnerable populations. But I think it's important, especially for those that are elderly and maybe have underlying conditions, that they would try as much as possible, to work from home, or to try and limit going out as much as possible now that the cases are increasing.
Talking about the elderly, are you happy with the progress made of vaccination for, especially now, the older people in the second phase?
Yeah, look, I think we would have wanted our vaccine program to be a lot further along than it is at the moment, going into a third wave. As you mentioned, there's a very small proportion of the population that's been vaccinated. And I mean, we only started vaccinating our elderly last week. So I think going into a third wave, we haven't been able to provide that protection we would have liked to. Obviously, it is good that we finally are seeming to make some progress. And we really need to just encourage people to register and get vaccinated, as soon as possible. Obviously, there are some, hiccups along the way, but at least it does seem to be happening at the moment, but maybe not fast enough.
Will this third wave come our way with new variants?
Yeah, so we have detected some new variants. So with the second wave, we had the variant that actually had developed first here, and they all called by these long numbers, but it was the B1351, which was the variant that was dominant in our second wave and actually has spread around many countries around the world. And recently, I think it was about 3 weeks ago now, 2.5, 3 weeks ago, we had actually detected the variant that was first discovered in India, which is the 1B1617 in some travelers from India. So at the moment, we haven't seen any circulation kind of in the community. It's only been limited to travelers. But we've also had circulation of the variant from the UK. So their variant was detected also towards the end of last year, the B117. And so especially in Gauteng, we have seen quite a lot of circulation in the community of that variant. So at this point, there seemed to be definitely our kind of the variant that was first detected here, as well as the one from the UK circulating. And we're doing, lots of testing to try and determine, how much this is spreading, because it's difficult to know if any of the new variants will become dominant. It has to have some type of advantage over the variant that's currently circulating. And the type of advantage would be if it could spread easier, or if it could kind of overcome our immune system somehow. And at this stage, we don't really know, but it's something that's possible. And I think when, they were doing some of the modeling for, predicting the size of the third wave, I think one of the things that we don't know is if there's the new variant that's potentially spreads more or can, evade our immune system, then potentially we could have a bigger wave, because then you would have infection of people who've already been infected. At this stage, we really don't know enough, but there definitely is spread of these other two variants. And yeah, the possibility of a new variant at any time, because that virus is mutating all the time.
Now, to what extent are the vaccines actually correct and effective for these variants?
Yeah, so I think most of the vaccines have shown to be effective against them. They may not be kind of as effective as the original, virus that they were made for, but definitely there has been good enough effectiveness. And definitely for the Pfizer, I mean, we know it was almost, in the US, almost 100% effective against the original strain of COVID. And so they have shown that although it's slightly less, it will still provide good protection. And so even if the vaccine is not 100% effective, we will still be able to protect a lot of people, and also be able to decrease transmission. So I think at this stage, we would, really continue with the vaccines. And both the Johnson & Johnson and Pfizer have been shown to be effective against the existing variants.
Apart from the effectiveness, there must be enough of these vaccines to actually get to all the people, especially the elderly and those that are more vulnerable. Now, do we have the vaccines in the volumes that we need?
Yeah, well, I think there is, in theory, I mean, that we have had the required number of doses promised to us. And at the moment, we've received a large shipment of the Pfizer vaccine. We're meant to also be getting some more of the Johnson & Johnson vaccine. So that one was used amongst the healthcare workers, remember, as part of that phase 3 rollout. But the next kind of consignment of Johnson & Johnson vaccine hasn't arrived yet. So I think there definitely are potential problems with supply, and not just here. I think in other countries as well, particularly the African and less developed countries, unfortunately, are coming in at the end of the vaccine pipelines.
Okay, and what are the stumbling blocks in the rollout so far?
Yeah, so I think, obviously it's trying to get up to scale. This is the first time we've really had to vaccinate a lot of people in a short period of time. I think we've always had our infant vaccination programs. So I think it is trying to obviously be able to train people to vaccinate, to get enough, people to do the vaccinating. Some of them are volunteers that are volunteering to help out. I think just in terms of getting the logistics right, the Pfizer vaccine obviously has special storage conditions, and so you would need to, that does limit, it has to be stored frozen. So that does limit how much, what quantities we can put out into some of the rural areas that maybe can't store it like that. I think just in terms of also, with the increased case numbers now, we need to really, make sure that we're not getting lots of elderly people together in one place where there's a risk, that they may actually be exposed to infection as well. So we would really want to do it in a way that can limit large gathering of the most vulnerable people who need to get the vaccine. And I think in the country, unfortunately, there's been a lot of an increase in vaccine hesitancy, especially amongst the elderly, with a lot of the conspiracy theories doing the rounds. And I think we really do need to put, efforts into trying to allay the fears around vaccination. And vaccines have really decreased infectious diseases. It's been the most effective way that we've dealt with infectious diseases. And I think people sometimes forget that all those vaccines we've received as children, have prevented us from getting some serious diseases. So I think the vaccine hesitancy is a big problem. And just in terms of even the number of elderly that have registered on the vaccination platform, we really do need to try and increase that number.
And then there are fears also that some of these vaccines might not be safe. Can you give the guarantee that whatever we have in South Africa will not have that kind of problem?
Yeah, so I think people often say, oh, these vaccines have just, been rolled out so quickly and they haven't been tested properly and, we're all guinea pigs. And I think that really isn't true. I think there's been a lot of research and testing which has gone into these vaccines, actually probably more than any other vaccine. There's been a lot of money and a lot of, investment by many in terms of these vaccines. And so I think the problem is that we're rolling out large numbers of vaccines. So if you look at the example with the Johnson & Johnson vaccine in the US, where, if you remember, the vaccine was halted here as well, where they saw 6 people who'd got, a kind of a clotting, a problem with clotting. But I mean, that was amongst 6 million people that were vaccinated. And so that may just be the normal amount of a certain condition that you would see anyway. But because we're vaccinating so many people, you could see these, problems, in people who were vaccinated, and people automatically attribute it to the vaccine. So definitely it's good to know that these are being watched very, very closely. We haven't seen amongst all the healthcare workers, I think they had vaccinated almost 500,000. We didn't see any episodes of the clotting, which seems to be, something that was a concern in the US. And so at this stage, I think we are always going to be monitoring the safety. You may get, some mild side effects, as with many vaccines. In people who've had the flu vaccine, you sometimes get some pain in your arm. You may have some mild symptoms. But overall, it's going to be a lot less than you would get if you had to get the disease. And what we really want to stop is severe disease. So the vaccines may not necessarily stop you from getting kind of mild disease, but we really want to be able to stop people being hospitalized and dying from the disease. And so I think people might also think, oh, well, the vaccine's not working if they get mild symptoms, but that might actually have been, they might otherwise have landed up in hospital or have died, and in the end, because of the vaccine, only got mild symptoms. So I think at this point, I think no real safety concerns that has been highlighted in South Africa with these vaccines.
Well, we know in the United States, almost half of the population there have received their jabs. Now, in South Africa, we are way, way behind. Do you think we will get to the stage where we have some herd immunity?
Yes, definitely. And I mean, I think the US and the UK is a very good example as well. And it'll be interesting to see because, they've both vaccinated a lot of their population. And I think in the US, the CDC's even kind of put forward recommendations now that people who have been vaccinated kind of don't have to wear masks and things like that. So I think we would be able to achieve, a higher degree of immunity, even if there are kind of variants that maybe don't, where the vaccine's not as effective. I think rolling out the vaccine is going to decrease transmission, and we will be able to get to the point where we have herd immunity. Obviously, if the vaccines are slightly less effective, you may need to vaccinate more people, to reach that herd immunity. But I think definitely we will be able to move towards that point where more and more people have been either infected naturally or have received the vaccine, and then we will slowly be able to get back to kind of, the old normal.
Well, while we're talking now about that, can we ever expect to have a normal life, whatever that means? But
sure. I think eventually we will. So if we look back to the kind of the swine flu from 2009, that virus was a new virus, but now it's part of our normal flu season. And so I think COVID is going to just be, part of one of the, circulating respiratory viruses. And hopefully we will, get back to normal. I don't know. I think with all the increase in use of technology, I think some things have changed and won't go back. But definitely in terms of interactions between people, we would hope that there would be improvement, hopefully. If we can roll out the vaccines quickly, I think by next year, I think we can start, looking to a life beyond COVID.
Do you personally believe that the government's control and handling of this whole situation has been up to standard, and do you actually feel quite okay about that?
Yeah, I think it's difficult. At the beginning of this, no one really knew. Personally, when we first heard about it, we didn't know it was going to become this worldwide pandemic. And I think with the knowledge that you have at the time, you have to make the best decisions. I think, I think the government has tried as much as possible to be transparent, and we've definitely learned a lot of lessons. And I believe at the moment, I think transparency has definitely increased. So for example, with the variants, as soon we knew it about those on the Saturday, and by the Sunday, the health minister had made an announcement that we had detected these variants. And so definitely, look, there have been hiccups with the vaccine program. And with various things, but in hindsight, it's always easy to say that things could have been done better. But we don't have the knowledge that we have now. When we started off, then, and I think there were indications that we might have had a lot more deaths and things like that. And so we had to react in the best way we could at that stage. And I think now we're maybe able to tailor it a little bit better. In terms of not having to deal with, the big economic fallout. And so I would hope that going forward, we'd be able to make choices, that are really look at the risk benefits, to everyone.
One gets the impression that the government wants to control everything. Do you personally believe there's a bigger role for private sector to play?
Yeah, look, I think I think the one good thing with this is that we have had a lot of interaction between the public and private sectors. And I think definitely just from the NICD point of view, we now have reporting, both private and public labs reporting all their data into us. We've set up a hospital surveillance system, which includes all the private and public sector hospitals. And so I think it really has been an opportunity to integrate. And I would hope that with the vaccine program as well, that we would see integration of the vaccines and the vaccine rollout, because I think what you don't want to see is people who are, who maybe can afford the vaccines or, to be getting easier access to them than to others. So you would want equitable distribution of vaccines. And I think that would be, very important.
And use of the money, because we've heard all sorts of tales about corruption already in industry people in this sphere.
Yeah, so I think corruption is an ongoing, problem. I think that, people are trying to deal with, and I think we need to be cognizant. And I think transparency is the big thing. If we can really be able to see where these doses are coming from and where they're going, and keep a good handle on where they're being distributed, that we can try and, preempt and stop some of those possible areas where there could be corruption creeping in.
Do you believe that we have the experts who can actually really help to solve these problems and tackle it? You yourself, for instance, the unit where you're working, are you happy that things are funded correctly and that you can do your work very productively?
Yeah, look, definitely we have the expertise. And I think there's, both in, research units across the country as well as in, places like the NICD, definitely we have the expertise. Obviously, as a middle income country, I think we do not have, the funding capacities of some of the, countries like the US and UK. And so we do have to, obviously don't have the same level of funding for projects. But I think, I think there could always be improvement, obviously, in terms of funding allocation. But bearing in mind that, the country has come through, I think quite a difficult year in terms economically. But I think definitely we have the expertise to be able to deal with all the issues.
One can imagine that people like yourself must have been very busy in the past few months. Give us an indication of what do you actually do in practice in the struggle that you have against this virus?
Yeah, so I think a lot of our time is spent just being able to put out the numbers. So we collate all the testing here. And so for, every night actually since the pandemic started, we've actually been able to report and the minister puts out a report on the number of cases that we've had. And I think a lot of our role is in terms of getting all of those data, properly collated and cleaned and sorted out in terms of, allocating to the different provinces. Our labs are able to help with a lot of the sequencing. We put out weekly reports. So I think a lot of ours in terms of monitoring and providing the data that can inform, a lot of the decisions being taken maybe by the ministerial advisory committees and by the Command Council in terms of, we're providing those data which can inform a lot of the decisions. So I think we've been very busy in that side, as well as providing, so the NICD provides a lot of technical support to the provinces. So we have epidemiologists based in the provinces who are able to help there in terms of how to analyze their data. And so in terms of this outbreak and other outbreaks, we provide technical support as well as putting, good data out into the public domain, by various, we've got vaccine frequently asked questions. We have a clinicians hotline where clinicians can phone in to ask questions.
I think you probably had your jab or not?
Yes, I have. So I got the Johnson & Johnson, I think towards the end of March. And I had actually no side effects. So and definitely I think, would encourage people to go for their vaccines. I think it's the only way we're really going to get through this.
Well, then in closing,
I hope you're registered and we'll be going for your vaccine.
Yeah, well, I hope I can get to that as soon as possible. But nevertheless, as it may be, just in closing, is the central message that you want to give to the public?
Yeah, look, I think at this stage, is, when your turn comes, roll up your sleeve and have your vaccine. And I think until that time, really to be able to protect yourselves and others, and especially the vulnerable around you. And although we are tired of wearing masks and having to, not gathering big groups, I think at the moment, it's really important that we do actually, stick to those. And it's mainly to limit, the increase in hospitalizations and our health system being overrun. So I think really at this point, try and stick to the guidelines in terms of decreasing transmission and vaccinate as soon as you can.
Thank you very much, Dr. Groome. Much appreciated. Go well, and I wish you.
Thank you very much.
Thank you.